Welcome to the latest podcast, and I'm here on Maternity 2, which is part of our maternity unit in Stepping Hill Hospital. And the reason that we're here this time is we had a fantastic celebration recently when we had our latest set of naturally conceived triplets. My understanding is that that occurs one in every 8,000 births, and we have had 4 sets of triplets in the last 10 years. And this is an award-winning unit. The parents were bowled over, not just with their 3 bundles of joy, but with the care that our midwives delivered.
I'd like to thank the whole of the neonatal unit and whole of maternity at Stockport Hospital.
They've also got another celebration. I'm pleased to say that our midwives came top in the whole country in terms of immunising against influenza our mums-to-be. And we've had that award for the last 6 years. It's so important that mothers and their babies get influenza inoculation, because that stops what could be a really serious illness and also safeguards the rest of their family. So well done to the midwives for that accolade. Constantly are trying to find ways to improve both flow within the hospital because of the high numbers of patients who are needing to be admitted, but also because we've got some problems in discharging patients as quickly as we would want and is good for those patients. So we've got a brand new initiative which is sometimes called Breaking the Cycle. It's about doing things as well as we possibly can, each member of the team working to their optimal in terms of performance, with the aim to actually get flow through the hospital and to admit people quickly and discharge them even more quickly. We know that's the right thing for patients to be at home. And so we've called this initiative Home for Easter. The Home for Easter initiative is around getting our partners, both the hospital, the community services, social care, GPs and our Greater Manchester Devolution partners to work with us to help ensure that everything at ward level runs as smoothly as possible. So if, for example, a patient needs an X-ray, is that done as quickly as possible? And if not, there's somebody to go and chase it. So we'll be telling you in future podcasts how well that went, but it's a super initiative that has been used elsewhere, and we've got the Easter period over the 5th to the 11th to make sure that we manage this cycle as perfectly as we can. And there's going to be some changes to the board of directors. Both myself and Judith Morris, the Director of Nursing and Midwifery, have announced that we're going to retire at the end of this calendar year. And we've done so giving 9 months' notice so that everything can be done to recruit our replacements and we can have proper handover. That's really important in terms of continuity. I've also got another announcement, which is that Sue Toll, who has been our acting Chief Operating Officer for a number of months, has now been recruited permanently to this position. Now, Sue is very much in charge of all of the clinical services in the hospital, and she works with the medical and the management teams to get things working optimally. So well done to Sue in this challenging recruitment, which was very much open to open competition, and she starts immediately. Adrian Belton has been recruited as our new chair for the organisation. He starts properly on the 1st of June, but again we recognise continuity and handover was really important. So he is going to be shadowing Gillian Eason, our current chair, for the next couple of months, learning the ropes so that he takes over in full knowledge of the challenges and the achievements of this organisation. Now, Adrian has had a number of executive and non-executive roles, both in the private and the public sector, and so we know that we've got a really experienced new chair. And in terms of further recruitments, nursing recruitment is something that we're really keen to increase, and that's both qualified and unqualified members of nursing staff. So we've got a major campaign, In Search Of, And what we're looking for is people who have the right values for working in this organisation. People who absolutely understand that patient care is at the centre of everything we do, that understand the importance of communication and teamwork, of innovation, and constantly challenging ourselves to make sure that we can forever improve in our services. If that sounds like you or a friend of yours and you're a nurse, then please do contact us and respond to our campaign In Search Of. And as ever, I like to end the podcast talking about some awards. And we've been awarded as finalists in the Health Service Journal Awards for two of the people that I've spoken about in previous podcasts. One is the pre-operative team and their work around anaemia, and the other is Wendy Oakes, who is working on acute kidney failure. So we're keeping fingers crossed that they both end up being the chosen ones, but it is fantastic for them to be finalists in this prestigious award. And finally, we've also got to final stages in the Student Times Awards. And again, it's lots of crossed fingers to ensure that we actually get to the very top of that. Well done to all of you.